Recently, I spoke with Dr. Dara Cass. She is the U.S. Department of Health and Human Services Regional Director about this increase of respiratory cases and why they're spiking. Obviously, we're more en masse. We're gathering more closely this fall than we have in a few years here, and that's why we're seeing more of these illnesses, especially in kids. But we're also seeing just as high a rate in places and states that ditched these protocols long before we did here. So is that the real answer? What's happening here, do you think?
So I think the most important thing to acknowledge is that right now, not a lot of people are wearing masks indoors. Right now, we're seeing high levels of circulating viruses. What has been done in the past is in the past. But we need to deal with what we're dealing with in the moment, which is that we are going further indoors. We're seeing the weather get colder. So it's important that as many people be up to date with their vaccinations, be aware of their respiratory symptoms, stay inside if they're having a cold, and actually mask up indoors if they're feeling unwell or they're in a high-risk space.
And we'll get to vaccinations in just a minute, but I think you brought up an interesting point there. How much of a factor and how aware do people need to be, especially kids, if they have already had COVID? Could that be weakening immune systems and making them more susceptible to these respiratory illnesses we're seeing here?
Well, I think that a lifetime of exposure to viruses, and more importantly, our own personal experiences are personal. I would say that we need to make sure that we keep as few people infected as possible right now. Our children have had viruses their entire life, and so if they've had COVID or another respiratory virus, that again is their previous infection and previous immunity. I'm not so worried about that going forward, but we need to make sure that we're aware of their symptoms right now as they go back to school and they're in environments where they could either give a virus to somebody else or more importantly, get it from kids in their class.
Hopefully they don't have it yet. How do families, at this point, you mentioned vaccinations, how do families protect themselves, the kids? How important are vaccinations?
So vaccinations are critical. They have been for viruses and other illnesses for most of our children's lives. They've been vaccinated since, 2 months old. They start their vaccine series. It's really important that all of our family members, from our children to our parents, even our grandparents, stay up to date with their vaccines, including the updated COVID vaccine, including their annual flu shot, and any other vaccines that they may need to keep themselves safe.
Obviously, we are doing it by having this conversation, but how else do we stress to families, and obviously maybe it goes beyond us to maybe other people, trusted messengers out there that see this, that those vaccinations are so important for the flu, for COVID, because it seems like, at least to me, the messaging doesn't seem as often and as urgent as maybe it was a year ago.
So, look, we are in a different moment now than we have been in the past, and that's a great thing. We have more people vaccinated. We have better understanding of what's going on, and we're back in work. We're back in school. That's awesome. It's also really important that we acknowledge that staying up to date with this updated COVID vaccine, making sure that people are up to date with their flu vaccine, keeps us in school, keeps us well, and make sure that if for some reason we do get infected, like lots of people are, that they are as protected as possible so that their body can really be able to fight off the virus as best as they can.
From what you've seen, Dr. Cass, what is the strain? I mean, we've certainly seen headlines. We've heard children's hospitals are packed, pediatric beds are packed with kids with these respiratory illnesses. But what are you actually seeing? On the ground, what kind of strain are we seeing on the hospitals, really the healthcare system overall, I guess, by all these respiratory illnesses this fall?
So the stress on the hospital systems for pediatric hospitals now, and obviously the adult hospital systems in the past, has been real. And it's a combination of lots of issues, related to staffing, related to other illnesses, relating to, people coming in for things like heart attacks or strokes, or in pediatric hospitals for other illnesses as well. The most important thing is that we keep our hospitals open and that we keep our beds open for people that need it. So not every kid that gets RSV is going to need to be seen by the doctor or even go to the hospital. Not everybody that gets COVID is going to have to be seen in a hospital. But we need to make sure that we have those hospital beds available for those people that do get sick, that maybe are vulnerable. So it's really important that we look at our hospitals around our community, that we keep ourselves as protected as possible. We start at the beginning by being vaccinated, by washing our hands, by staying away from people that are sick, and staying home if we ourselves feel sick.
Don't know if you can do it in 30 seconds. When do you know when you should seek emergency care, especially with your kids?
So I will speak to parents out there to say a parent knows. A mother knows when her child needs to be seen by the doctor, and you can never be wrong to call your pediatrician and ask for guidance. And if you are ever worried that somebody doesn't look well, you can always go to your local emergency department. We will make time to see you.
Dr. Derek Cass, she is the Regional Director for the U.S. Department of Health and Human Services. Dr. Cass, thanks so much for your time. Appreciate it.
Thank you so much.